In terms of privileges, like if you are Malaysian, we enjoy basically free healthcare, right? Whenever we go to a clinic kesihatan or a hospital, normally we don't have to pay anything. But that is not true for this community, at least a large part of this community. Right now we are at Omadal Island. It's a small island off the coast of Semporna, right? So among the issues that we are trying to address here is increasing their health access. It's quite a distance away from Semporna, far and quite expensive for them to actually get any sort of healthcare. And due to their status of being stateless, healthcare is actually expensive for them because they are not considered Malaysians, right? And which is something that they cannot afford, right? Because they earn far less than what we can even imagine. Right? Some of them earn as low as 2 ringgit per day. Right? So having to pay for healthcare is just out of means and a luxury that you cannot afford. This is our community health center, manned by our community health helpers. What we provide here is actually basic healthcare services, especially first aid services, right? Because they lack any sort of healthcare service, this kind of bridges the gap, right, and addresses their needs. Previously, there never used to be any sort of healthcare or medical services. Even like a small cut or something like a common cold can actually even lead to a loss of life. So since we established this, Shima and a few others that we train are able to provide first aid services that has been proven to improve the prognosis, in other words.
Okay, untuk manual, mungkin bila macam tadi saya cerita dengan manual kan, kita bawa budak-budak pergi.
Before we established this setup, we also found that their belief in modern medicine was actually also pretty low. By training the local community members, like Shima, who we saw just now, we managed to bridge this divide a little bit. The community trusts modern medicine a lot more. They seek medical attention, especially from our clinic, a lot more.
Okay, 5 tolak 1. 4. Jadi di sini kamu punya kotak dalam buku kamu. Jadi cikgu ndak.
Hai, nama saya Shima. Saya berumur 20 tahun. Saya di sini sebagai penyelaras kesihatan pelajar dan juga pembantu kesihatan pelajar. Selain itu, saya guru komuniti juga di sini. Pusat kesihatan komuniti ini adalah sebuah pusat untuk memberikan rawatan asas kepada komuniti yang tinggal di sini, komuniti Bajau Laut dan komuniti tempatan. Dan selalunya mereka akan mendapat rawatan yang asas seperti demam, luka, selesma. Kalau melibatkan baby ni, kami akan minta pendapat dengan doktor. Jadi doktor akan bagi list apa yang perlu dibuat, ubat apa yang perlu beri. Jadi dari situ Shima akan dapat buatlah apa yang doktor suruh. Pusat kesihatan ini saya rasa penting, sangat penting, kerana di sini juga satu tempat untuk memberi kesedaran tentang kesihatan kepada komuniti, terutamanya Bajau Laut. Dorang tiada akses kepada kesihatan, pendidikan. Kalau kita lihat di sini ramai lagi kanak-kanak yang masih bergam dan dorang tidak belajar. Gam tu bagus untuk mereka ataupun tidak. Dan di rumah dorang pun kurang makanan. Jadi salah satu sebab dorang mau tahan perut tu, dorang akan bergam.
While working on these projects, we also realized there is a real issue of substance addiction. And what is more heartbreaking, it is very much more prevalent here among children. A lot of them resort to using glue. Okay? And why glue is also because it's one of the cheapest things that is available. So it was very heartbreaking for us to see very small children, as young as maybe 3-4 years old, sniffing glue. We cannot be here looking at them and just letting it be. So that's where we came up with this safe space center idea, where we are going to provide some kind of psycho-education, some kind of psychotherapy. And because we are dealing with children, we don't want to use medication, right? And We want it to also be a community-based approach whereby we are training the community members to actually conduct most of our sessions. What is coming up is like music therapy, art therapy, right? This will be delivered mainly by the local community members whom we are planning to train lah.
Saya pernah sekolah sampai darjah 6 saja. Saya pun faham perasaan budak-budak kalau tidak belajar, sebab saya pernah belajar sampai ke darjah 6 kan. Jadi saya pun rasa macam berminatlah untuk mengajar di school.
Iya. Dia boleh kan aku pinjam sini?
Community members themselves have a lot of potential, right? But they lack opportunities. For example, is Shima, right? Shima is actually a brilliant individual. If she was in a different setting, especially with an IC, I honestly believe that she could have gone very far in her life. She's very hardworking, she's very intelligent, and most of the time, when you actually do provide them with an opportunity like this, right, they take it and they really soar with it, right? Improving their quality of life cannot happen without improving the economic part, right? Without having a source of income, this will not be sustainable. They cannot improve their quality of life, right? So that is why it is best the health aspect goes hand in hand with the economic aspect. So what we wanted to do is establish a seaweed farm for them, which is a lot more sustainable, using more sound techniques, right? Because we have experts, we have collaborated with UPM, and UPM experts are working with us to refine the methods, right? So that it's more sustainable, and especially with the climate change right now.
The yellow on the surface actually is the kind of microalgae that grow on it. So seaweed is one of the most sustainable aquaculture product you can get. So seaweed absorb nutrient, use the sunlight to grow, and then at the same time, it do not have any negative impact to the environment. Our participants come from Bajau community. So we have the ladies, we have housewives, we have also young people, and also some men that have some experience in it, who will be the main guide also in the whole farm. There were some massive disease problem in the past, so that once it happens, they don't know how to start. So this is what we are trying to assist them, to teach them about the disease and the biology, and also to understand the season because of climate change. Even the season have been changing, so they do not know how to actually adapt to it. So this is something that we want to be part of it, to see how we can become to have a sustainable farm in long term. So this area is very suitable with a very good water quality, and also not very far from their village, so they can come often. So we can see that a lot of interest on the seaweed, especially as a supplement, as a food. And so what we are trying to do is we want to move away from the traditional just selling the dry seaweed, because with the influx of tourists into Semporna, actually there's a lot of new market for the seaweed. So we are also trying to assist them in looking for new marketing opportunity. Ambil je ni bro. Sana je lagi.
Pulau Omadal sebenarnya bukan tempat yang asing bagi kami lah, sebab ini bukan kali pertama Yayasan Hasanah menyokong program di sini. Pelibatan kami dah pun bermula sejak tahun 2020 melalui program e-school. Tapi masa tu fokusnya lebih kepada pendidikan asas untuk kanak-kanak Bajau Laut. Apa yang kita buat sekarang adalah kesinambungan pendekatan yang kita panggil community based approach atau CBA yang kita mulakan beberapa tahun lepas. Jadi bagi kami, isu-isu dalam komuniti ini tak boleh dilihat dalam satu sudut sahaja. Sebab tu pendekatan kita dari multi-dimensional approach dan memerlukan jangka masa yang panjang dan penyelidikan yang lebih detail lah. Selain kita juga dapat bina kepercayaan melalui rakan-rakan pelaksana kami. Contohnya rakan pelaksana kami iaitu Malaysia Society for Harm Reduction atau MSHR. Mereka ni bekerja dengan komuniti dari pelbagai sudut, daripada bantu tambah pendapatan melalui penanaman rumpai laut, menyokong juga kesihatan komuniti melalui community health helpers dan telemedicine consultation, sampailah kepada usaha mereka untuk mencegah penyalahgunaan bahan dalam kalangan kanak-kanak dan remaja di sini. Pada masa yang sama, kita juga bekerjasama dengan Pak Bidin. Mereka juga bukan sekadar sebagai pembikin filem, peranan mereka di sini juga sebagai mentor dan juga pembina kapasiti. Melalui dokumentari dan penceritaan, komuniti terutamanya golongan belia di sini diberi ruang untuk bercerita tentang kehidupan mereka sendiri dengan cara dan suara mereka.
Bro, aku ada kerja, sorry.
Dengar cerita ada bengkel Fatbidin lah, bengkel buat filem. Jadi saya rasa macam wow, dalam senarai 15 orang tu saya punya nama ada di dalam. Jadi saya rasa macam ada peluang lah dapat ikut. Jadi tidak expect pun dapat salah satu pengarah muda. Dari bengkel membuat filem tu kami dapat kamera, mic, apa namanya tu? Bukan, yang pusing-pusing itu apa tu? Gimbal. Gimbal. Kami dapat gunakan dengan sebaiknya lah. Macam kami sudah belajar tentang cara membuat filem, video, angle, jalan cerita pun kami sudah belajar. Jadi pentingnya kita untuk membuat satu ataupun banyak pun lebih baiklah cerita mengenai komuniti-komuniti yang jarang orang tahu ataupun jarang orang lihat lah. Sebab komuniti beginilah yang perlu kita bantu dan itu adalah salah satu cara untuk kita mahu mereka lebih dilihat ataupun lebih dikenal. Kita akan membuat satu cerita lah untuk mereka. Saya harap mereka mendapatkan apa yang sebenarnya mereka perlu ada. Sebab sakit rasanya bila pendidikan tidak dapat, kesihatan sangatlah dipinggirkan. Jadi agak sakit sangat. Jadi saya berharap semoga satu hari nanti mereka juga dapat apa yang mereka perlu dapat. Saya berharap satu hari nanti. Itulah.
Jadi bagi Yayasan Hasanah dengan sokongan Kementerian Kewangan, inilah CBA. Bila komuniti sendiri memegang pelbagai peranan dan jadi penggerak perubahan dalam kehidupan mereka. Ini adalah ekosistem dan hubungan yang kita bina bersama komuniti. Projek boleh tamat, tapi keupayaan dibina tu boleh terus hidup dalam kalangan masyarakat di sini.